because of COVID. And if before COVID, we see that 2019, early 20, and before, ministries and prime ministries and governments, they are deciding only let's make a trial, or let's think what is the necessary infrastructure we should build in the future. So everybody look at telemedicine only as a future activities and not confirmed models of implementation yet, and finance, of course, not yet. But after COVID lockdown last year and this year, and a huge number of ill people and overloaded health systems, everybody understands already that telemedicine is one of possibility to decrease this overloading to the health infrastructure, and in fact to save lives, because this correct treatment will give less complications and less deaths. So now we are talking to many health authorities in many countries, and situation in mind is changing. We cannot say that it is not it is changed already, but it is changing to real steps. This is very important and first challenge which we should use together. That's it. Katerina.
Thank you very much. So just a few information, you already know that, but I can just underline that many health providers are investing in remote patient monitoring solution and devices worldwide. And that possibility of observe and report, analyze patients' data, it's actually the matter that is important around the world, and have possibility to monitor in a real time what is going on with the patient, and especially if it is chronic patients and patient during COVID-19. And we face a situation that we understood that many people just afraid even go to hospital and visit the clinic. So actually remote patient monitoring becomes sometimes the best solution, where it's possible to monitor actually the health data about the patient. And here you can see the slide regarding the use cases that we use most of all. It's most common in worldwide with diabetes, people with some problems with heart. And we are, as a developers of the solution, and can establish such ways and help to different countries and our distributors that we work now with 16 countries. And here you see that possibility of monitor vital signs, can build transparency also between doctor and patient. And communication has proven to be critical in healing and recovery. So to build the trust between the patient and building the one aim, one goal between the patient and the doctor. So connected healthcare here is critical, and I will use the opportunity to make to show you, before we go to our use cases with which we are working, I will use the opportunity to show you a short video about our main product, telehealth medical diagnostic system, IDIS2GO. Some of you already know about that, but we have also new participants here. And I will share my screen from another point. Hold on.
Will you send this presentation to all participants? I think so.
Sure. After that, after our meeting, and I make the recording, I will send the recording for you. So here is our video regarding telehealth medical diagnostic system. Sorry for those who already saw that, but we will go after about our use cases with this system. First, I will make quick overview.
Telehealth medical diagnostic system, IDIS2GO. Remote diagnostics in any patient location. Comprehensive IoT platform with wide range of connected medical devices. Medical data transfer and storage for immediate doctor access. Artificial intelligence for medical results interpretation. All examinations in one bag. Smart and simple in use for nurses or paramedics. Anytime, anywhere. IDIS2GO collects diagnostic data and sends it to the IDIS2GO cloud. Diagnostic reports dashboard for doctor with AI. IDIS2GO is ready to go to remote and rural areas, chronic patients, elderly people, disabled and limited mobility people, self-isolated patients during COVID-19, checkup points of ambulatories, pharmacies, companies, telehealth points, transport and airports in any patient location. The world is facing the COVID-19 pandemic. Telehealth medical diagnostic system, IDIS2GO, is serving to stop corona in more than 15 countries. Many people are at home with limited access to diagnostics and proper treatment. Outpatient clinics can manage this risk using IDIS2GO, sending nurses or paramedics at home for checkup. IDIS2GO can perform video calls, and diagnostic results can be printed for patient convenience. The platform is complete and independent, with interfaces for nurses and remote doctors, but also can easily be integrated in existing medical information systems. Even in remote areas with lack of internet connection, IDIS2GO stores data in offline mode and sends it automatically when a connection appears. For companies with many employees, IDIS2GO makes on-time, immediate checkups. 12-channel ECG with artificial intelligence doctor decision support in the right moment may prevent cardiovascular disease or stroke. Medical-grade, high-quality diagnostic tools that are wired to IDIS2GO telehealth medical diagnostic system, 12-channel ECG, blood pressure monitor, spirometer, pulse oximeter, glucometer, urine analyzer, infrared thermometer, ultrasound scanner, stethoscope, fetal Doppler, hemoglobin and lipid testing systems, dermatoscope and otoscope, white blood cell analyzer, POCT analyzer, and others. IDIS2GO serves to patients in the most remote areas of the world, like Amazonia and the rainforests, helps to monitor life and health even at its very beginning, and continuing to care during growth. In public health, IDIS2GO plays an important role in the creation of modern telemedicine infrastructure, new quality of life, and remote access to medical professionals. All data is secured according to GDPR and data protection protocols, in the clinic or far away from it, in transport hubs or military units, in pharmacies or deep in rural areas. Telehealth medical diagnostic system, IDIS2GO, a new era in digital health infrastructure. Made in Austria, works worldwide.
It was our short video regarding our telehealth medical diagnostic system IDIS2GO, and I will continue now sharing the presentation to go into the cases actually that we faced with IDIS2GO during this year. And we can see that here is the testing of IDIS2GO in Brazil, and we already work in the states, with different states of Brazil, and now proceeding the registration of our main monitor basic kit. Even without the registration, we already able to import, and we sold the IDIS2GO to Brazil because a law that the products that help to prevent COVID-19, and IDIS2GO is such kind of product. It is able to sell this product in this country. So we already made dozens of presentation. For example, here we can see the pilot project in municipality of Paraná, and we've made already around 6 pilot projects in this state with a very remote cities, small cities, bigger cities, for example, starting from 30,000 inhabitants there and till 200,000 to show how it is important for remote areas, because there sometimes it is lack of doctors who work in such small villages and cities. And during the COVID-19 last year, they was even locked down without any possibilities to go out somewhere for the big city. And IDIS2GO in this case served to collect oil data and send to doctors from big hospital facilities, for professionals there, and help in that case. Here is also our Mexico case of IDIS2GO. And here we work also with a distributor who serves and have examples working with big military hospitals who also need remote diagnostic. And for them, for the such special cases of military units, we even do some special IDIS2GO setups that is closed. We know that we work with the cloud, as you know. For military purpose, we even make some turnkey solution to keep all data with them, because for militaries it is very important to store and collect all data only in their facilities. And here is proof of concept, as we have done in Amazonia, as you have seen in a video regarding indigenous, yes, Amazonian rainforest. IDIS2GO even make the route on the river, not only with a car or a flight, but even a few hours on the river to reach very, very far village. And they have a house point. This project was in cooperation with big mobile company who provided the internet connection for this region. And here it is example of proof of concept of how the indigenous and all people there, it was last around 2 months. And especially it was when this special dangerous Amazonia coronavirus type was appeared, and many people were afraid to even go to such area. So also IDIS2GO in that case helped, that collected the data that sent to Sao Paulo and other big cities to help to understand what's going on with the people, because sometimes even without IDIS2GO, lack of them have any kind of possibility to reach healthcare and to make the high quality diagnosis. So here you see that IDIS2GO and our example in that really helped. Sergey, if you want to add something, please feel free also to add while I'm explaining our user cases. Next one here, it is our native example. It is on Austria, in Graz, and also during the COVID-19 and in other clinics also there. IDIS2GO was put in a small ambulatories and in a hospital to make the quick checkup without necessity to send patient to different kind of doctors, different kind of labs. So in one point, as you know, we have a wide range of connected devices. It is possible to make regular checkup or some special according the needs of the patient. And during the COVID-19, actually, it helped a lot. We can see that before COVID, of course, everybody understood necessity of telehealth solution, and we participated in a Medica and in Arab Health before COVID. But after the strong lockdown that happened around the world, really many people understood that it is inevitable now. So it is no time to wait using telehealth solution. It is a need right now. That's why we can tell that even during the corona, we work twice a lot than before with different time zones and our partners in many countries to help to stop the coronavirus spreading and give possibility to people who are afraid to go to the hospital or have lack of such possibility. And even during the COVID-19, for those of them who don't need the hospitalization, but they can be treated at home, also the nurse came with the IDIS2GO and make the checkups that need to be done for such kind of patient. and it also helped not to load too much the hospitals in some region where IDIS2GO were used. Here is also an example of IDIS2GO in Aziz Chateaubriand. Also, it is a Brazilian municipality here, and I have a small video from the mayor of Irati, one of the cities of Paraná state. It has English subtitles. I will show you a little bit.
Irati, projeto piloto do sistema IDIS2GO. Estamos com o prefeito recém-reeleito, Jorge Debre, aqui da cidade de Irati. E nós temos aí a grande satisfação de, como já falamos, dizer que foi aqui o projeto piloto no Brasil, um sistema extremamente moderno de saúde. Prefeito, qual é a importância de um sistema de tecnologia extremamente moderna para a área de saúde do município, como é o caso de Irati?
Primeiramente, queria agradecer por Irati ter o privilégio de ser a cidade piloto do Brasil, de estar trabalhando com esses equipamentos, que, sem dúvida nenhuma, a informática hoje, a telemedicina, a longa distância com esses aparelhos, o trabalho que foi feito pelos nossos técnicos de saúde, proporcionaram aos pacientes um melhor atendimento, porque com esse equipamento a gente conseguia, lá no interior, por exemplo, fazer o diagnóstico de um paciente, fazer esse trabalho sem que a pessoa precisasse se deslocar até um posto de saúde. Irati sai na frente, graças a vocês, a esse programa do IDIS2GO, que para nós é uma coisa que realmente é uma remodelada, sabe, na questão da saúde de Irati. E não só de Irati, mas como do Paraná e do Brasil, porque o equipamento, a informática, a tecnologia hoje vem, sabe, associar a medicina, a telemedicina e trazer essa melhoria na condição de vida das pessoas que precisam. Então, realmente um processo que aconteceu, foi aprovado e nós queremos dar sequência nisso para que a gente consiga, o mais rápido possível, ter todo esse equipamento disponível no município para atender e melhorar a saúde de todos.
Perfeito, a gente agradece em nome da equipe IDIS2GO, toda a sua equipe. O projeto piloto foi definido para ser Irati, em razão da agilidade, da eficiência da equipe de Irati. Nós nos sentimos assim realmente em casa, porque nós tínhamos que testar o sistema, ver como ele funcionava lá na fonte. Então, a gente agradece muito a toda a sua equipe, o senhor Agostinho, a área de enfermagem, a Jussara, a secretária, o secretário de planejamento, o João. Então, a toda a sua equipe, porque realmente nos recebemos de braços abertos e a gente pode ter a certeza hoje de que nós testamos equipamentos, fomos lá na ponta, as equipes estressaram os equipamentos para ver como funcionava e realmente o resultado é muito bacana. Então, nosso muito obrigado à Prefeitura de Irati, o seu trabalho, principalmente, de ter liberado as equipes, liberado os espaços para que a gente pudesse fazer o projeto piloto no Brasil. Muito obrigado, prefeito.
Isso, só quero finalizar e dizer que foi um privilégio para nós testar esse equipamento e realmente funciona. E a modernidade vindo aí, a tecnologia junto com a saúde para melhorar a condição de todos.
Perfeito. Obrigado.
Okay, so it's an example of Iraq. Also, I can continue with examples that we use from other parts of the world. Sergey, you can add something if you want during the presentation to switch on the camera in case you want to add something to Brazilian examples. And here you can see our Kazakhstan distributors who also work in very, very remote areas in Kazakhstan. They have different regions and for them it is important to have an ultrasound as an additional device that we have in our system because they monitor also a lot of pregnant women in some remote areas in this region. So for them was especially important to use ultrasound in our system. And also what is interesting, we have wide point of care with a wide range of tests. We call it like for IDIS2GO lab. And it is possibility to do very about 35 types of testing, including some drug testing, hormones, cardiac marker, renal, tumor marker. So it's also interesting in that case to make without the laboratory up-to-date diagnostic and send it to the doctor. So here I will finalize with IDIS2GO user cases. If someone wants to add something right now, please feel free to do this. if you want to add regarding IDIS2GO, who already knows the user cases of IDIS2GO. And before we go to other part, I can give the word to Senior Augusto, who wanted to share his experience. Will be very interesting for us also to listen. Please, before we go to the next part, it would be interesting to listen for your experience. So around 5 minutes, please share with us. Senor Augusto, do you hear us?
Yes, good morning.
Please feel free to share with us your experience with patient remote monitoring solutions that you use.
If you, yes, if I want to share our experience in Argentina, but our experience have 6 years old. We start before the pandemic, and we develop a network to support several rural areas that we have productions. If you can you permit me to share the screen?
Yes, hold on. I will give you the rights. Please.
Okay. Can you see?
Mm-hmm.
Okay. Well, Argentina, I think that Kazakhstan or Ukraine have a lot of remote areas. We develop a network in a central medical attention in Buenos Aires, in the capital of Argentina. And we develop a UAR, Unidad de Asistencia Remota, or Remote Assistance Unity in English. If you see, this is our first central, and we have special areas to support with medical doctors that you can see there. It's a boxes with two screens, and you will see why we said 2 screens, and each other are different areas to support with medical doctors, remote areas that I will show you. This is the new area in Buenos Aires. We moved to another intelligent building that you can see. This is again, it's before pandemic, a few years ago, when the medical doctors stay there supporting the remote areas. Now a lot of them are deslocalized. They are in their houses, but the area is very interesting because you can see in the left down something. Someone have the microphone open. Can you? I don't know.
Please use the microphone if someone has a separate.
Okay, sorry. Okay, if you see again the boxes that support, but the other in the right down, we have the area that we have all of us supporting when we have a problem that is a specific problem. All of the medical doctors enter to support this patient when the patient is or when the disease is very complicated. All of us supporting them. In pre-pandemia, in this room, now we connect all of the medical doctors that are working in this moment. See a map of Argentina, and you can see all of the remote areas that we are supporting. In the left, the bordering with Chile, all of the Andes mountains is, Andes mountain is more or less the Alpes mountains like you. It's areas with high altitude, very, very high altitude. When I said high altitude is areas that are workers that are mining at 4,000 meters in high altitude. So it's very difficult to live, it's very difficult to work there. And the other in the south of Argentina is Patagonia, is like a desert in the south. It's very difficult area too. And I will show you how we support these areas. First, see, for example, this Google Earth that you can see that the all is brown, is not green because the high altitude. These white parts, there are salars with lithium. In Argentina, we have a lot of salar of lithium. We have a lot of mine of lithium. Remember that lithium, you need to develop batteries for electric cars. So this is a rich area that we have a lot of mining, exploring lithium in a high altitude. All of these lithium minings are in around, again, 4,000 meters in high level. And remember that the roads from this area to a big city with the big hospital, you need 5, 6, or 7 hours driving an ambulance. So remember the difficulty to attend the patients. See, the area is a desert, it's a big desert. See our problems that we have when we transport people, see? We have, because the high altitude, the hypoxia is a several hypoxia, and you can do wrong things, like this driver. I was driving in another truck, and see this driving, what happened because the hypoxia. These are the supporting that we do in these minings. See, for example, this mine that I am flying to, this mine in the middle of the desert. See an airport, that you can see in this middle of nothing. See how we land in these several areas. See, if you see, this is the plant of is a plant of lithium mine, and we support there with our experience telemedicine around these 6 years. This is the landing or again the area, and this is our experience now. We support, for example, now I am in the remote area. I am taking oxygen because the altitude is very difficult for us. We have many hypoxia. In this area we have snowing, and we started to support 6 years ago with multi-parametric monitors. You can see the patient, we, and the monitor. So the central medical doctor in Buenos Aires, with all of the medical doctors there, are supporting the all of this. If you see, well, I don't know.
Augusto, it is really impressive you're showing us such things. But we unfortunately have a time limit, so we need to go further.
We have a limit. Sorry. Well, I will stop to share.
Someone still have a unmute microphone, I guess, with some songs.
What happened?
Mm-hmm. Thank you so much, Senor Augusto. Really, this very, very remote areas with a lot of difficulties to work and possible to remote remote area with the passengers and patients who are in such complicated conditions?
Actually, what is Senor Augusto showing, it is tele-anesthesiology already. He is translating the screen of multiparametric monitor and can get advice from an anesthesiologist how to manage a clinical case.
Yes,
but it is only a video translation or chat. No transfer of real diagnostic data. So next step should be platform which transfer real diagnostic data to medical information system in this case.
The situation, sorry, I have a problem with it. We share my screen, but this experience that we have in Mainz, the next screens are, we start with minings, then we pass to support in dams, then we support in boats in oceans, and then in oil and gas in on and offshore platforms.
Great.
So
great.
For us to have an evolution with equipment is very interesting, but now we are focusing in a medical support. Why I told this? Because when I start to work 12 years ago, we start to focus in use medical device, but if you don't train the people to use, the problem is don't use, and we have a lot of information around the world to non-successful telemedicine networks, because they have a lot of equipment, but the medical doctors don't use. So for us, we do at the inverse. We first train to use, the medical doctor trained to use telemedicine few years ago and develop the network. And in this network that we start first with video conference, we put a monitor multiparametrics, stethoscope with Bluetooth, X-ray images, digital records, pass step by step, and now we have a big network around our country without problem. I don't know if it's clear for you.
It's clear. Thank you very much. You are supporting medical units where you have existing doctors. And you probably your consulting center,
yes,
if you are now explaining that they send you monitor data, X-ray data, it means that they have X-ray at this point of care. So it is not paramedic device.
We have
a small medical unit with doctor, with some nurses, and you make some examination, and this simple doctor just need consultancy, what to do, how to manage the patient.
Sergi, in some places we have medical doctors and nurses. In some places we only have nurses. In some places we don't have anyone, we have only technicians. In some places we have ambulance. In some places we have planes, but we don't have ambulance.
Great network. Congratulations.
Mm-hmm.
So
applause. It is a great network. It is a great job, Mr. Senor Augusto. Appreciate.
Give me 3 minutes more to share the.
In 3 minutes we will close the webinar. Okay.
Give me 3 minutes only,
please.
See for example, this area that we have, for example, the medical doctor and that we see the patients and we see the X-ray unit too. And see, for example, these are big dams that we support. See this experience. We have offshore, if you can see the helicopters here, offshore units in the middle of the oceans of oil and gas, or onshore experience. See this experience. Boats that enter 1 month in a sea to fish and have an industrially of the fishes. It's they stay 1 month working inside the ocean, and we support them with telemedicine. So we have many different situations that there is not easy, because, for example, we have a lot of storm and we must to support again. We develop this medical area that you are talking, Sergi. In the past was a simple area, and we step by step were giving more complex this simple area that sometimes are only young nurses or young medical doctors without experience. So our central in Buenos Aires with a lot of medical doctors is very important. See how we support them. We support connecting with monitor multiparametric, we seeing at the same time the digital records, or talking, for example, to these nurses how to examine some patient, or how to do some operating.
Treatment manipulations, yes, thank you.
For example, our ambulance that I developed, that there are ambulance with a respirator and monitor multiparametric with connectivity. So we don't only support in a remote area, that if we have connectivity during the transport, we support during the transport critical patients. And finally,
yes, unfortunately, we need to go further because we have only 1 hour to talk with the people. But
okay, sorry.
That it is really impressive that you are showing, and this experience is really great for all of us.
Colleagues, this is clinical network. So this is example, brilliant example of medical use of telemedicine instruments, starting from simple one. They started from video chat, video conference several years ago. Then they increased with transfer of diagnostic data, and they created full service 24/7 consulting telemedicine support center, which supports these remote locations. And the customer, I think customer should be insurance company who pay for all these tons of equipment and all these services. They created now, Senor Augusto explain and show how they create point of care already. So they equip with some unit where patient can lay, get treatment. So this is very important for these remote locations. We see a real working medical service network, which combines on-site and remote diagnostic, treatment, consultation, and this is very well paid by insurance, because all these people are workers, and insurance better support this on-time treatment than pay for treatment of complications of diseases. We understand that treatment of complication is 10 times more expensive than treatment when it is just first symptoms of disease or trauma, for example. Thank you very much, Senor Augusto. It is a real, alive, big example, and we will be happy to cooperate with you with our technologies, because in some locations we are sure that our technology will add more to your existing system. Thank you very much.
Thank you. Thank you. Thank you again.
Yes.
Sorry about my time.
Thank you, Sr. Augusto. It was one more time
Impressive.
impressive for all of our participants to see this great infrastructure that is existing in Argentina. And if someone also want to add, please raise your hand or let me know somehow in the chat that you want to add something regarding that.
Yeah.
By the way, do you hear me well? My connection is...
Yes, absolutely. Just one compliment of Mr. Augusto Itig was saying. Actually, Dr. Augusto Itig is our partner in South America, and we are trying to exactly use his huge experience here in Portugal to promote telemedicine here. And even, well, the complement would be exactly that. Use the technology of yourself, associate with the experience, the large experience of Mr. Augusto Itig. Even here in Portugal, Dr. Augusto Itig is our partner here in Portugal to implement that. Okay, that's the concept. And or in also obviously in Latin America if you have possibilities.
Great, and thank you for your sharing. I just want to underline that we have round table, so all participants here have possibility to talk and share the experience. You can also share your ideas or experience regarding user cases of patient remote monitoring. We are here because of that. And I see in the chat also for us said hello, Mr. Nitin Watt from Oman, Muscat. Hello, Mr. Nitin. Thank you for participating also in our webinar. And we are going further. So we have talked about Argentina experience, Senor Augusto. We have showed our user cases of IDIS2GO, and many of you already know this solution. Next part, we want to, by the way, Sergey, do you want to add some more user cases regarding?
Yes, if possible,
please.
Very shortly. I just returned from Central Europe trip, and focus in, for example, in Slovakia, I have meeting with Ministry of Social Policy, Ministry of Health, Ministry of Economy, and they take Miss Governor of region, and they pay attention to elderly house, to elderly and home care, and they immediately catch the idea of IDIS2GO and immediately invite us to participate in existing project for 14 elderly houses in one province, because they understand that nurse, who is the most used person and worker in elderly house, equipping with objective data instrument to get objective data, can serve much better as regular treatment, regular checkup. It is one story, and immediate in case of some troubles with patient, it is another story. So they are interested in two sides of technology, where nurse can do checkup by timetable as regular checkup of these people, and request for consultation in case. This I would like to add, because all other remote location, Dr. Augusto already shown, nothing to say. All other remote location are very clear for everybody, thanks to presentation of Dr. Augusto. Thank you very much again. Thank you.
Great. So this we talked about the connection between doctor and patient with the nurse, help for making examination with different kind of devices. And I want to go into the second part to show our user cases and possibilities of patient remote monitoring platform the show to doc that we work with a white label, and I also will use the opportunity to show the short video, first of all, also for first time on our webinar. So I will use this possibility. Do you see my screen? So short video regarding show to doc.
Doctor to patient communication and monitoring platform. This is Paul. He loves when everything is connected. Show to Doc supports his treatment, connecting him with his doctor for early detection of changes in his health status. His blood pressure monitor, pulse oximeter, and other devices can immediately send data to Show to Doc. Paul also loves to receive reminders to take his medications. Paul's doctor monitors his health in real time and sets up daily questions for his patient's diary. During a pandemic, Show to Doc can significantly reduce the numbers of heavy cases and hospitalizations. And this is Stephen. He is in self-isolation outdoors. Stephen's doctor monitors his health status changes every day and can detect COVID symptoms on time. Show to Doc, full scope outpatient treatment with no visits to the clinic, convenient task management, simple video calls, timely live chat, doctor prescriptions, patient diary, vitals monitoring, scheduling, and much more. This is Anna and Pedro. They are expecting their first child. To avoid unnecessary visits to the clinic, they use Show to Doc. Now the doctor is monitoring Anna's vital signs and is always in touch if they have any questions. With Show to Doc, they are much less worried. Isn't that right, guys? Quick chat available for instant feedback, regular prescription monitoring, user-friendly intuitive interface, video calls in emergency cases. All vital signs and symptoms have already been entered by the patient. Time, cost, and life-saving. This is Alex. He thinks he has the flu or maybe COVID. He connected with his family doctor right away, and after some testing and a video call, it is obvious that he has an allergy to his new cat. The family doctor transfers Alex with his Show to Doc subscription to an allergist. Yes, it can do that too. Showtodoc.net. Partner for care.
So it was a short overview about our Show to Doc system, and I will give a few words to Sergey while I will continue showing the presentation. Hold on. So it was our next slide regarding Show to Doc. And you will not hear about Show to Doc in any country because we don't go with Show to Doc name, obviously. We go with a white label, so we offer to distributors and network of hospitals use their own brand, and we issue branded application for patients with their branded names. And here you can
Let me help to explain. Of course, brand Show to Doc is registered, and but this is software which can be uploaded in the local data center in any user or any country. We have Show to Doc in Brazil, and we have Show to Doc in Austria as a Show to Doc brand and service. But what we have investigated, that white label is much more sufficient for business purpose. Every big network of clinics or service provider, for example, like Dr. Augusto network, they would like to carry their own brand, not and patient to get mobile application with brand of network, not of clinic, not of commercial company. It is one story. Another story is that you can, or several projects may be supplied with different brands and use different price policy, which also can help to focus on public market, on insurance market, on private market. So also price and monetization models may vary. This is second. So we are open to cooperate with a hospital system integrator, with a distributor for sure, because we have all tools, all instruments for management. Distributor can use his brand, have distributor portal with administration of all users of clinics and statistics, analytics, billing information. So this is an instrument for remote patient monitoring as a business model, first of all. Continue, please.
I want to continue to show you that we also use and show to doc a wide range of connected devices. For some clients, it is very important to have connected devices. But we also have made a manual input of in devices data inside show to doc. And on other hand, doctor from his account receive all analytics with graphs, what is going on in real time with the patient in this moment, with all devices that are connected and sending automatically data, or it was manual input by patient. Here you can see a blood pressure monitor, fetal Doppler, infrared thermometer, glucometer, small ECG, and pulse oximeter. And I will ask also Sergey to tell about example of United Kingdom of using small ECG for cardiovascular disease patients, because in that case also remote monitoring is very important for them.
Actually, thank you. Actually, there are several part of remote patient monitoring which are paid by reimbursement. We have investigated the biggest experience of reimbursement for several remote patient monitoring instruments, let's say. For example, in UK and in USA, most states of US and all United Kingdom, they reimburse 3 instruments. First instrument is video chat, video consultation, and they pay for that to clinic. Second is patient application, several various, with questionnaire, with medication management, with task management, with any information for patient for his disease. They reimburse this as a separate part of remote patient monitoring. And third is diagnostic, using home diagnostic and transfer of diagnostic data and consulting of this using this diagnostic data. You see that Show2Doc platform combines all of these 3 group of instruments. In Show2Doc, we have a video chat, we have chat, text chat, we have task management. So it means that doctor can generate task for patient to measure, to take a tablet or pill, to make some fitness exam or test questions, and all these 3, and home, you see home diagnostic. All these 3 parts are in one glass, and it is this cocktail fits all tastes or all part of reimbursement. And clinic can get more money with more instruments. And in Great Britain, we have invitation from company which actually makes medical services of Holter ECG, Holter diagnostic. And they are growing with artificial intelligence for Holter first. And this is reimbursed, this is paid by Oxford Clinics network in UK. And when we show them that we have simple ECG monitor, and it is another story, because Holter you can attach to patient for 1-2 days, not more. And we have ECG, which can ECG monitor. It is simple, like one channel ECG, but using several probes, several part of this device, you can collect three channels one by one, not not all together, but one by one you can collect several channels ECG and check first of all arrhythmia symptoms. First of all, arrhythmia symptoms and other symptoms of heart attack using this simple and inexpensive monitor. So now we are integrating with this company and going to first clinic in Glasgow, Edinburgh, excuse me, in Edinburgh, with division of cardiology of Oxford clinic from Oxford Network. We are happy to explain this example, and of course it is example from rich country which already fix that it is telemedicine and we should reimburse telemedicine services at official base by law, and they of course pay to service provider, to medical service providers, and our task is to give to medical service providers best instruments for this business as a business model. That's it.
Thank you very much. So that was regarding the show to doc that is working first of all for chronic disease patients and they use device, and even if they in their country they don't want to use device, they can still continue to do manual input inside. And what is important, the questionnaire that doctors puts every day, for example, not to call to a patient, not to think and remember to that you need to ask something. It is automatically asking, and patient have to answer. And from the other side, patient feel the care, that doctor really cares about him, that he can send a message, well done, let's go further. And it's also dedicated chat messenger in show to doc. It's not personal WhatsApp number, it's not Viber number. It's also very important for doctor because it keeps his personal time and he can divide it also using show to doc for.
Let me explain more about time saving. We had already discussion with German friends from Münster University Faculty of Family Medicine, and they say, what is show to doc? It is you would like to charge, but look, our national provider gives video chat platform during COVID for whole country, for all doctors for free. So how we can compete with free platform which any doctor can use, and now it is free. And we come back and say, look, let's calculate cost of doctor. Because if you start, and we did this calculation, if we start to calculate the time, this time spending in video chat when doctor asking patient about his concerns, asking patient about his symptoms, asking about medication taken, asking about changes of health status, and asking about also measurements, temperature, SpO2, blood pressure, and others. And patient explain this, because doctor can ask quickly, but different people explain in different way, you know. And doctor should fix all this information. It will take 15 minutes, this conversation, at least. And if patient use our platform, he has all questions already. He has all tasks and reminders in mobile, in smartphone. He appoint fact of taking the pill. He appoint or confirm the measurement or write manually the weight, for example. He shows that he do it on time. He answer questions. So 90% of information is done by patient, interactive mode. So when doctor open his profile, he see all information already, all measurements, all questions, all symptoms, all medications, all tasks done. or not all. And also he see that he missed some measurement or missed taking pill, or because Shotodoc now gives 2 hours, a task reminder and 2 hours to fill up the or confirm. And doctor in this case, if he needs any conversation, he will reduce time of this conversation 5 times at least. It will be maximum 3 minutes he spent for one patient per day. Or sometimes he will not talk to him. He just sent him in chat, he just sent him message. Oh, Bill, hello, everything is fine, continue. Or change this dose, take it double, for example. And patient from his side also see, yes, somebody is revising my data, and it's good. They give me a feedback, a reaction. So if to calculate the time saving of doctors in this situation, free video platform is much more expensive in the point of view of spending and cost of doctor time. And immediately from this point, we should go to other, which is already used in several countries. And I'm sure in Dr. Augusto network already also used that in call center. In this case, the doctor is not sitting. It is not doctor of telemedicine in this case. Maybe a nurse or specially trained personnel, which is less expensive than doctor, can get from doctor the monitoring protocol, and they will look at patient profile and push him in case he missed something, and only touch doctor when parameters are outside of norms, because our system gives possibility for individual setup for each measurement, for each question, and each parameter individually for a patient. If it is outside, it is red and alert. If all measurements and all tasks are done, everything is green, nothing to touch the doctor daily. Maybe doctor will read a weekly report about patient monitoring. That's it. So this is the difference between video, just video conversation in this case. Thank you.
Thank you very much. We still have lack of time, and I understood we need to make more webinar in the nearest time to talk more, because we have all lack of time for this webinar. But we will go further. Just here was already we discussed the Shotodoc devices, and here just to show you the IDIS2GO devices that are already part of our system, that are connected to IDIS2GO, that can be used for any kind of examination. You can see here, I will not read the slide because you can see everything what is here. So the basic...
We are growing now with lab, point of care, immediate testers, and in fact, it can be used like tabletop portable diagnostic lab already.
Yes, we have actually a request from Chile, a big insurance company, and they made a big research to find more dedicated lab testing systems that can be wired also to make this remote diagnostic. So here was the last slide, and I'm also open to, please, if you have some questions or doubts, or you want to offer some vision, opinion, advice, or question, please don't hesitate to do this. We are here to talk with a round table. So you can write me in a chat if it's not convenient to tell it in the microphone in your environment, or you can also send me after the webinar your questions, and we will prepare for the next session the answers for the webinar. So as you can see that a patient remote monitoring It's going around the globe already, and pandemic showed that it is inevitable thing to monitor patient in a distance, in another location, not in a hospital. And as we see here in Argentina example, and also in Brazil and Kazakhstan, it's huge territories with a very, very remote areas, even sometimes without a road. And there are also patients who need to be attended.
Katerina, let's finish our meeting.
Yes, it is also, we are also finishing already because we have lack of time for everyone and all need to go back to work. And one more time, I appreciate your coming. Hope it was interesting for you to listen to these examples. It will be the recording of this webinar, and I will send it to each participant also with a presentation. And I want to tell that next week we will be in Austrian Health Forum. If you will be in Austria, please go to our stand. And we also have here our distributor from Dubai, and we know the next week also starting a big Arab health exhibition. If you will be there, please visit NAFCO stand. You will find there IDIS2GO and show to doc to also to touch hands. I think I was correct. So thanks a lot, everyone, for being
Thanks a lot. We waiting for your questions, requests, comments, and our cooperation. Have a great weekend, colleagues.
Thank you very much. Bye-bye, everyone.
Thank you. Thank you very much.
Thank you.
Bye-bye. Thank you so much.
Thank you.
Thanks a lot.
Thank you. Thank you.
Thank you.
Thank you. Thank you, everyone.
Bye-bye.